You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host with today's guest.
To another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. CVS, Walgreens, URI. Put it in your car, put it in your purse, but take it out at night because the weather affects it. But one big thing, it saves lives. My guest today is Neighborhood Health, Dr. Chris Aniano and Tracy V. Her name is this long, so we put it down to this big, Tracy V. Welcome, both of you, and thank you for joining us.
Thank you for having us.
First of all, thank you for being a sponsor of Recovery TV, a long-standing sponsor, by the way. So thank you so much. So Doc, I'll start with you first. What's going on with Neighborhood Health?
Well, as you know, and first of all, we are very proud of being sponsors, and we are very glad to be back here. The Voice of Hope is doing a wonderful job, and we're glad to be a part of that. Where to start with Neighborhood? The story goes back quite a ways. As a long-term sponsor, I'm sure you and your audience have heard me say 30 plus years now, 31 going into 32 years. Of being a really important part of healthcare in the state of Rhode Island as a managed care organization. And probably our biggest transition in the last year that you and I have been talking about was bringing behavioral health into our own walls. We had been using a vendor for that service for many years, but having professionals in our building, like Tracy, has allowed us to bring behavioral health services internal. So now we have the expertise, the care managers. We're doing all of that work right in here, in-state neighborhood, again, being that small Rhode Island business that's been growing with Rhode Island healthcare.
One of the major factors right now in Rhode Island and throughout the country is mental health. You're seeing a lot of issues pertaining. We've had a number of issues in Rhode Island. How do we combat the issue of mental health? Number one, funding is a big part of that, right? Number two, education is a big part of that. And number three is access to care is a big part of that.
Yeah.
So how do we put all three segments in a room to get it done? Because if we don't, it's progressively getting worse. I've been following a lot on the internet as far as professional sports. A lot of people in professional sports are having issues. A guy growing up, I see playing professional hockey. The other night, comes out, the torch, Montreal Canadiens. The next day, he commits suicide. We had an issue in Smithfield a few weeks ago with a young lady on a bridge, ready to jump. It's happening more often than I want it to happen, but it's happening. So how do we get everybody in a room, and I know that you're part of this, behavioral health, mental health, it's a really big problem, and we have to try to nip it in the bud. We have to educate people. Funding needs to be ready to go. Overdoses need to stop. There's new substances coming into Rhode Island every month. Every month.
Yeah. I think one of the key words, and I think Tracy will pick up on this immediately, is integration. That is a huge part of why we insourced it. Would you agree?
Yeah, absolutely. And I don't think that you can undervalue the importance of early intervention and screening, because the sooner that folks can get support and treatment for a mental health condition, the less likely it is to worsen to a point where folks need crisis intervention. So we really want to advocate for folks to talk with their provider as soon as they have concerns. And also destigmatizing talks about mental health and substance use, because folks are less likely to seek care if they feel shameful or embarrassed about it. And so the more that we have conversations like this and normalize talking about mental health, everybody has mental health, right? We have physical health, and sometimes it's better or worse. And we have mental health, and sometimes it's better or worse. And so we really want for folks to just feel empowered to get help when they need it.
And you bring up a good point. I mean, the questions that docs ask now when you go in for your annual physicals or your follow-ups, people think it's a joke. because the docs are asking that question. Do you feel okay? Are you okay within yourself? It's not a joke.
No.
You look at it as when you read it in the paper. It's not a joke. Suicides are on the rise. Why are they on the rise? Those questions need to be asked, and they need to be answered in a professional way.
Yeah.
Because if you don't ask the questions, people keep it inside for a long period of time. Like some of these athletes that have committed suicide. You know, I mean, well, I was an athlete. I was a Stanley Cup guy. I was a World Series. I was in the World Series. We don't care. We care about your mental health. We care about your well-being. When people take their own lives, I don't think they realize the ripple effect to the families. What you leave behind.
And I'd also, to pick up back on one of the things you mentioned being access, they might not appreciate all the different access points because it doesn't seem obvious. You know, if you have a behavioral health provider, great, there's a source of access. If you don't, seek out your PCP. Your primary care provider can help get you to that next step. And then some people might say, well, I don't even really have a relationship with my primary care. What then? Tracy's team and neighborhood have care managers who can be that first point of contact. We're not providers, but we facilitate care.
Right.
So we've got a team of care managers.
Access point. If people don't have the right access point, it could be a long period of time before you get to that point. As time goes on, the problems could get worse, and there's no turning back. And I say this, not to be funny, but when we've had about 5 suicides in Northern Rhode Island over the past few weeks, most of them by hanging. But once you kick that chair out or that ladder out, there's no turning back. So access points are very critical, very critical for folks. And on the behavioral health end, there's a lot of other things that go with behavioral health. It's not just suicide. There's a number of things. So what is neighborhood doing? And that's the question I get all the time. Well, what are the healthcare providers doing to curb this problem?
Yeah. I mean, some of the things that we're looking at Neighborhood are conducting a full access assessment for our behavioral health network so that we can better understand where there are wait lists, what kinds of services are most at risk to have a lack of availability, because it's a different question if you're saying how easy or difficult is it for me to get an outpatient appointment for therapy than is it for me to get specialized eating disorder treatment if I live in Newport, right? Those are very different questions, and so we're really trying to take a deep look into that. We're having conversations with our provider network now that, as Chris mentioned, that it's in network, and we have relationships with our providers to see where we can innovate and do some new and different things to expand access. We've partnered with some providers who have innovative models around using coaching staff to provide service to expand the availability of the clinical staff. So we're taking a really hard look at those things, as well as some other clinical programs that.
I want to talk more about that when we come back. We have to go to break, but access points, innovation is another one. It's not the same old anymore.
No.
We've got to think of something different. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Neighborhood Healthcare Plan is in the house. Dr. Chris Aniano and Tracy V. Welcome again. Thank you for being a sponsor. Greatly appreciate it. I want to talk a little bit about schools and triggers. Tell me what neighborhood is doing, or are they doing anything in the schools today on behavioral health?
Yeah, I would say neighborhood specifically isn't doing anything in the schools, but we have a number of provider organizations within our network who do. So some of our providers have school-based clinics or have outpatient clinicians who'll go to schools to conduct treatment with kids there, particularly for kids who have issues, with anxiety or.
Is that one-on-one with the kids?
It can be, yes.
Okay.
Mhm.
What about families? What are you doing with families? Or are your organizations working with families?
Yeah, we work a great deal with families. So internally, our care management teams work both with individuals and with families to address the both medical and behavioral health needs of everyone in the household. We recognize kids don't exist in a vacuum,
Right.
You can't provide treatment for just a child without addressing the family system that surrounds
As a
it.
whole. As a whole.
Exactly. And so we, our providers, I think, do the same. And there's a continuum of services, everything from standard outpatient therapy, one-on-one treatment, all the way up to the highest acuity, such as inpatient behavioral health, and then everything in between, including, some enhanced outpatient services or home-based treatment services for kids and families that can provide supports both in office, in homes, and in the community.
I've been to a number of conferences lately, and they're talking about language and try to change the language of how we speak to people who need treatment, especially people who may be in a vulnerable state, and we say the wrong thing, which would become a trigger. How do you have conversations with your providers about language and about triggers?
Many of our providers really are the experts in that, right? They're the ones who are working directly with our members and families and provide some of that feedback to us. But like with everything, none of us are going to get it right all the time.
Right.
None of us are perfect. And I think we're recognizing where we might have slipped up and used maybe language that's stigmatizing or dehumanizing, and just acknowledging that, apologizing and adjusting, and just being mindful of the fact that folks with mental health and substance use conditions are humans first, right? That we're not defined by our medical or behavioral health conditions.
And if I could, John, a lot of those questions about, what is a neighborhood doing in this area? One of the critical roles we have is creating a robust network. That's probably one of the most important things that neighborhood does. For over 30 years, developing that network, not just of medical providers, but also BH providers now that it's insourced to us, having a robust network that has all expertise included. So when our care managers are talking to someone and someone needs help and is looking for access, we have everything at our disposal to be able to refer to, or any of our primary care doctors have an incredibly large network of behavioral health providers for whatever area you need to head into. And that kind of gets at that question of how do we try to make sure that care is most appropriate and avoid incongruencies or someone not being approached the right way. It's by making sure you have a network full of experts.
That's a very good point. If you don't have a network that you can offer a wide range of folks, male, female, and children, then you're not doing your job as a provider.
And particularly as a managed care organization.
Right.
In our work with the state of Rhode Island, and we've been doing that since day one in the Medicaid space, also in the commercial space through the Health Benefit Exchange, and now through our dual eligibles, Medicaid and Medicare eligibles through what we call a FIDE-SNP, or a dual eligible program. You need to have that sort of wide network to be available from birth to nursing home. You need to have everything available.
What do you guys all see with this HR 1, and what's going to happen with? I'm hearing all sorts of things of anywhere between 59 and 79,000 people losing their care. That's to me. I mean, you would know better than me. That's catastrophic. That's catastrophic. it's also catastrophic with uncompensated care.
Yes.
And now if these folks don't have insurances,
Yeah.
what's going to happen to the providers?
Yeah.
Because you can't turn them away.
Yeah, I mean, just to start out with some facts, so we get a sense of what we're going to be up against. We currently have a situation in the state of Rhode Island which has been quite good for uninsured numbers. You know, it's never perfect until you get it to zero. It's never perfect,
Right.
but it's always been in a low single digit sort of situation for many years. We could be looking almost at double digits again in terms of uncompensated care because people fall off their insurance. So the real tragedy in that is if you are eligible, but you fall off of it. And that is one of our major concerns, is that how do you make sure you stay on Medicaid when the new rule is going to mean twice a year, not every year having to be redetermined, but twice a year, every 6 months. That means keeping your information up to date with neighborhood, assuming you're a neighborhood member, or with the state is critical. That is the take home. You must keep your contact information accurate so they can reach you, your address, your phone number, place of employment, even the size of your family, if you have changes in the size of your family, marital status, everything needs to be up to date.
And people need to realize that, because that could be another catastrophic issue
Correct.
for the family.
Correct.
You lose your care.
You do not want to be at the pharmacy picking up an important piece of medication, or in an urgent care or an emergency room awaiting important care and find out you're no longer on the Medicaid roll.
Right. That's an issue. That's an issue. We're going to take another quick break. Thank you for that. I greatly appreciate that. You're watching Recovery TV. I'm your host, John Tassoni. We'll be right back with Neighborhood Health Plan right after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Neighborhood Healthcare Plan is in the house today. Dr. O and Mrs. V. How's that? Is that good?
Sure.
All right. And we're just talking about a few things, and we're going to put it up on the screen. 3 things that you need to do following
Yeah.
getting into October.
Yeah, given how critical it is to keep that information with the state, your contacts and all your demographics up to date, the 3 ways that I think you're going to put up there. 1, the website for Health Source RI. 2, the phone number for Health Source RI. And 3, because neighborhood is that facilitator that can help when you're having problems, is our own portal, members.nhpri.org. So those 3 ways are entrance points to make sure your contacts and all your information's up to date.
From the last time we met, has neighborhood grown in membership?
I would say we're holding about steady. Now, keep in mind that that's steady in the environment of people being moved off of the Medicaid rolls.
Right.
So, and part of that steadiness is the fact that, aside from the great work, Tracy and her teams, the behavioral health insourcing, we are immensely proud of happening, in the latter part of 25. But the other important factor that keeps our membership stable and growing is our new line of business. The jargon is FIDE-SNP, but it's just a funny way of saying fully integrated, dual eligible special needs program. So it's a lot of words, but basically it's neighborhood being there again for the state and for Rhode Islanders, taking some of the most at-risk Rhode Islanders, those who are eligible for Medicaid and Medicare, and providing a full program for them.
Well, thank you. We're going to have you come back on for that program. I want to talk about that. And I want to thank you both for coming on. I want to thank Neighborhood for being a sponsor. Next week, my guest is Renee Gomes. She's in long-term recovery. And then after this, please follow Kodak Live. It's a fully integrated plan to go approach the care. So, ladies and gentlemen, if you see something, say something. We'll see you next week.